Does anyone know what kind of symptoms patients can experience if they have a stroke?
One-sided weakness.
Yeah, they're going to have one-sided weakness. They could be hemiplegia, which is like paralysis on one side. That's the main one. They can be not cognitive. So they're basically, their whole body is like asymmetrical. That's huge too. So what would we do for those patients? What kind of measures would we do for them?
Like assessing them, or things you can do?
Just like interventions.
Like you might have to help feed them.
Yeah, that was huge.
But let them do as much as they can.
Yeah, promote independence. So stroke patients are on aspiration precautions. Does anyone know what that means?
It's aspiration is when food
Choking,
or water goes down the lungs.
Yeah, because they're going to lose their gag reflex. So they're on aspiration precautions. So basically you have to be super patient when you feed a stroke patient. So much patience. So it's because you want to feed them on the strong side of their mouth, because if they don't have any muscle tone on one side, they're not going to be able to chew. It's just going to go right down. So feed them on the strong side of their mouth. You want to make sure you feed them little bites so they can handle it. And then also you want to thicken their foods. If you guys taste in the lab, those nasty. So that's aspiration precautions. Also someone with a stroke, if they have hemiplegia and they just cannot move their left side, passive range of motion exercises, just in case they do recover, they have that range still in their joints. And they are also on like fall risk. So.
What about the neuropathy?
Do you know what that means? Anyone know what neuropathy means?
Numbness and tingling.
It's just no sensation, right? Diabetics. It's huge in diabetics. So like in diabetics, they could like step on a tack, or anyone with neuropathy. They have neuropathy in their feet. They could step on a tack and not know it until like someone told them, right? Because they can't feel it. And that's why infection is huge. A lot of people with diabetes get their feet amputated.
Is it like you can't feel it, or is it like numbness and tingling?
You can't feel it.
You can't feel it.
No sensation.
Okay. No sensation.
So I guess numbness, right?
Okay.
So now number 20, super simple, assessing cognitive function. How do we assess cognitive function?
Is that just the neurological focus?
Kind of, but not all of it, because numbness
Was
and
that
tingling
like-
doesn't tell you how cognitive
Was
they
that
are.
like that little mental
SE,
SE thing?
mini mental self-examination.
The
Yeah.
Glasgow's
That is not what it is, but that can definitely assist you.
The Glasgow's coma scale?
Mm. That's not, like there's a question for that. That one's more just to see how you're able to like, it's hard to explain. That one's just to see how responsive you are basically.
The stimuli, yeah.
Yeah, but this one, cognitive, is just like, because like in the Glasgow coma scale, you could get a 15 out of 15, or like 13, like which is pretty high, but still like I could ask you like, Carrie, I like your shirt, and you could be like, my cat is pretty. So like cognitive is just like how you respond to questions, if you're saying appropriate answers, if you're using appropriate talk.
Mm-hmm.
So like you don't come in, someone comes in the room and you don't say, hi, or see you later. Like that's not really that cognitive.
Yeah.
Or like, thanks for coming, Mom, and like you're the nurse. So cognitive is just measuring just like how they can answer simple tasks or do simple tasks and simple questions. So there's some parts that are in the neural part of the head to toe, and those would include like alert and oriented, like they're cognitive if we ask, tell me where you are right now, tell me your name, tell me the day.
Which one is the one that you were talking about? The Glasgow one? Which one was that one?
Glasgow coma scale?
Yeah.
We'll go over that in 26.
Oh, okay.
Yeah, we'll go over that.
That's the one where you can still get a 3, even if
Oh,
Yeah.
I see. All right.
Even
Sorry, I'm jumping ahead.
Yeah, okay. So cognitive ones, just like ask them simple questions like, what's your name? Who am I? Like, what's my job? And they're like, you're the nurse, or like, where are you right now? Things like that. So like people with dementia are not cognitive at all. They don't know, they get lost all the time. They're just not really there. They're not really present in their life. Does that make sense?
Yeah.
Okay. So it's not the whole neurological assessment. It's just how they can think critically. Okay.
Is that the one that where they were saying, like, don't count your chickens before they hatch? There was something in the book about that.
In terms of what?
Was that like
That
a
is
neurological
saying.
one though?
Like, what do you mean?
There was a book in the something like that somebody was asked. I heard somebody talking about that from tutoring, and they were like, yeah, there was like some saying about don't count your chickens before they hatch.
As in, like,
that.
don't assume your patient's
Like
all
you're
with
like
it?
asking them to like interpret that for you.
Oh,
Say it
really?
For you? Yeah.
Yeah, that's like a simple question basically, just like
Yeah.
just seeing how like they can think critically. That's a random one though.
Yeah.
Cool.